Strokes. A stroke can happen when there is damage to the brain that results in cell death. There are two types of strokes. There's an ischemic stroke, where the blood supply to the brain is blocked. And this can be from a blood clot or something called plaque. There's also hemorrhagic stroke, where there's a bleed in the brain where a vessel in the brain leaks or breaks open. The brain cells will die from the bleeding, and the leaking blood applies further pressure on the brain and causing more injury. There is also another condition you may commonly hear people refer to as a mini stroke. The real name for this condition is a transient ischemic attack, or TIA, and is actually not a stroke at all. The TIA is a temporary loss of blood supply and oxygen to the brain. The symptoms will be the same as a stroke, but they don't last. If your client is having a stroke, the symptoms will not get better and will not go away. TIAs are a warning sign of a stroke and should be taken very seriously. If treatment is given, a stroke can be prevented in the future. People who are having a stroke will have different symptoms based on where the damage is happening in the brain. The American Heart Association developed the following mnemonic: spot a stroke fast. F stands for face. Is it drooping or numb on one side? Ask the person to smile. A stands for arm. Is one arm weak or numb? Ask the person to raise their arms. Does one arm drift downward? Speech. Is the speech slurred? Are they able to speak, or are they difficult to understand? And the T stands for time. If the person shows any of these symptoms, even if they go away, call 911 immediately. Time is brain. Here's a nice picture showing you the FAST mnemonic. While that mnemonic will cover nearly all catastrophic strokes, there are still more vague stroke symptoms you should be aware of. A severe headache can be innocuous, but it can also be a sign of a stroke. Blurred vision, ringing in the ears, redness in the face, nausea or vomiting, incontinence, seizures, especially if they don't have a seizure disorder, loss of consciousness or dizziness. As a home health aide, you may care for someone who's had a stroke. Once a person has finished rehab following a stroke, there is often a certain amount of impairment that will just never get better. The home health aide can help with assisting with activities of daily living, assisting with eating and drinking, assisting with communication, especially if the patient has something called aphasia, where either they have difficulty forming words or they have difficulty understanding words. Assisting with moving and positioning, and preventing injuries and skin breakdown. When assisting your client with a stroke, always dress the weaker side first. And it's important to note here too that we don't refer to sides as good and bad. We refer to them as stronger or weaker, as we don't want the client to feel like the stroke is bad. So always dress the weaker side first. This prevents any bending or stretching of the affected arm, as they may not be able to feel if you're hurting them. Encourage the client to use adaptive equipment to help dress themselves. Occupational therapies have all sorts of devices that can be used to help people button buttons or put their own shirts on themselves. And of course, independence is incredibly important to somebody who's suffered a debilitating injury like this. Encourage and support independence as much as possible, even if everything takes longer. And remember to place commonly used objects on their stronger side when seated at a table or chair. When assisting somebody with eating and drinking, always follow guidelines set up by speech therapy for the food texture or thickness when preparing food to prevent choking. Place the food in the client's field of vision. Many people who've had a stroke don't see well out of their affected eye. Use special feeding devices if available. Always remain in the room when they're eating and watch for signs of choking. Do not use a straw if they have swallowing problems, as using a straw is the most difficult way to swallow. Observe for pocketing food in the weaker side of the mouth. This could be a choking hazard if that food is not removed after a meal. And always have the client sit in an upright position when eating or drinking. When assisting your client with communication, be sure to choose your words carefully. Never refer to a weaker side as a bad side. Keep questions and directions simple, and only ask one thing at a time. Try to phrase questions that can be answered with a yes or no. Give the client enough time to answer and listen very carefully. If you need to, use a pencil and paper to help you with communication. Have a bell or a call signal near the client so they can let you know when you're needed. And use communication boards, which are boards that have little pictures on them, to help them with communication if they have a difficult time expressing themselves. When helping your client with moving and positioning, encourage the client to use their weaker side and assist with exercises. Make sure to roll your client over on the strong side first when changing directions. And when the client is sitting, place a pillow or a cushion on the armrest to support their weaker arm. Ensure the knees are at a 90-degree flexion when sitting in a wheelchair or in a chair. And be mindful of body alignment, as the patient may not feel if their arm is dangling. Skincare and injury prevention are extremely important. Pay attention to skincare and prevent bumps and bruises as much as possible. Always check for sharp objects, wrinkled sheets, or heat sources for patients with decreased sensation. Use assistive transfer devices to prevent falls. And never leave a client alone in the shower or on the edge of the bed. This is the highest risk time for falls.